Hello and welcome to the 12th episode of our series Know Your Doctor, where we take a sneak peek into what's behind the white coat of our nephrologists. Today, I'm delighted to welcome Dr. Amit Kumar, who's a senior consultant nephrologist and a renal transplant physician currently associated with Medanta Hospital in Ranchi. He completed his DM in nephrology from the prestigious SGPGI in Lucknow in 2016 and since then has been dedicated to advancing kidney care in Ranchi. Alongside his hospital practice at Medanta, Dr. Kumar runs the Kidney Clinic in Ranchi and is the chairman and managing director of IKDS Hospital, a specialized kidney hospital he set up to provide comprehensive kidney care services. Notably, NephroPlus operates the dialysis centers in all these three locations, and we are delighted to have Dr. Amit Kumar as our esteemed partner. Thank you so much, Dr. Amit Kumar, for doing this episode of Know Your Doctor. Thank you so much for taking time out from your busy schedule to record this episode.
Thank you. Thank you, sir.
So we'll get started right away. And I think, Dr. Amit, I'd like you to begin by letting us know. I think when all of us are in our 10th and 12th, we're all wondering which stream to take. Some people opt for engineering, some for medicine, some for the arts, some for commerce. What drew you towards medicine? Was there a family history of doctors or something else entirely?
It's a really a good question. I actually answer this is on my some podcast. So actually, my family has having many of the engineers. No doctor background was there, and my grandfather once day told me there are many engineers in our family. So why not you go for doctors doing this profession, doctor? Because in my village there was no doctor at that time. So
Right.
that was the simple reason to start with taking biology and start my journey. I didn't think of like it will go on MBBS, MD, DM, SR then all these things. So it
Right.
has started just like this.
Wonderful, wonderful. And you did your medicine in Ranchi, doctor, or somewhere else?
I did my MBBS from the Darbhanga Medical College and MD medicine from Patna Medical College, PMCH.
Wonderful.
And then I went to Delhi and prepared there uh, for nephrology because in nephrology, this background came from my MD days because my mentor was basically a you can say nephrologist practicing nephrology, and that unit was of nephrology. So we had a natural interest towards nephrology and start preparing for this. And after that, I was in Delhi in RML Hospital as a senior resident, and there I prepared for various institutes, and I got the seat in SGPJ Lucknow. So then, and that journey was very actually good, and that gives us so much confidence of treating patients, nephrology as well as treating general medicine patients also because the teaching was marvelous there.
Nice.
So this was my short journey.
Very nice. Very interesting. And I think nephrology, doctor, there are so many kind of subspecialties. You have, of course, dialysis, you have renal transplants, you have CRRT, AKI, and so on. So in this, all these fields, is there something that interests you more than the others?
Yes, vein-wise, I was doing my DM nephrology there. At that time, we had a complete free hand on the fistula creation and all. So we
Okay.
used to do permacath, fistula, all interventions, and there was also a dedicated radiology team. So with collaborating with those people, I was uh, I suppose I did many a times this your dilatation of fistula and doing uh, exercise or various difficult your central line insertion. This was the scenario at that time. But when we came to this our private practice, then gradually we realized we have to more focus on acute kidney injuries, our post-transplant patients that requires a severe our specialized um, coordination or support. So right now we are more focusing on acute kidney injuries, post-transplant complications, and simultaneously we had a number of people on dialysis and their problems. So this is my main area of interest right now, because doing fistula and their complications and treating them, sometimes it is lengthy and it is sometimes go into surgeon's hand. So
Right.
gradually I switched uh, over these parts
Got it.
right now.
Got it. So over the years, and I think it's been about 9, 10 years, right, doctor, since you've started your nephrology practice, I guess. And is there some incident or some patient that whose memory you can never forget? Some interesting anecdote or incident that touched your heart? Anything at all that you would like to share with our viewers?
Actually, there are many uh, stories we can say like this, because these patients get connect with you
Yes.
uh, when you treat them in their difficult days. Because we had a young guy of like 25, 28 years old, and he used to uh, land up in pulmonary edema repeatedly, from this hospital to that hospital, and it was continued because when he skips one dialysis or sometimes one day of dialysis, sometimes he does not able to take, then really he's having severe accelerated hypertension, pulmonary demise. He has one wife and a very nuclear family, one small child of 4 years age. So for those persons, having single bread earning people who is on dialysis and his wife is uh, running here and there with small kid, that becomes very difficult. Sometimes somehow we actually motivate them, so why not go for transplant? So after doing 3 to 4 years of this dialysis and their complication, their family exhausted so much. Lastly, his wife go for kidney donation and his transplant done. And right now, when he came regularly visit our clinic, so I saw okay, how they are stable now doing his journalism. He's also very active in different social medias, and his wife is also settled. So that time it looks like his family is finished financially we and manpower wise. But when he got into transplant got successful, and gradually he start earning and he's doing very well. So these type of stories are like many of them who opt for the treatment which is for him, then it is very beneficial and that changes his life.
Yep. Very true, doctor. Thank you for sharing that incident. Now, I think we'll go a little bit away from your personal, from a professional journey into your personal life, doctor. So, I think who constitutes your family, doctor? Who all are there in your family, if I may ask?
uh, my wife is a radiologist, is
Okay,
uh, professor in RIMS Ranchi Medical
okay,
College
very
here
nice.
in Ranchi, and I have three kids. One boy is 9 year, he's on ninth standard, and twin daughter that is on
Okay,
of first, standard one. So
okay. Wow.
and my father all.
I guess it's too early, but you have any wish that you would like any of them to go into medicine, or you say no medicine, or what is your
Definitely, they will have to go for medicine, because I have built a hospital and they are residing nearby, and they used to come there, and they actually want to associate and start.
wonderful,
They
wonderful,
that is in their mind.
wonderful. And are you going to push them towards nephrology, or you will push them to take some other specialty?
This is very difficult to tell where to, but at least there should be interest in medicine or surgery or any background.
Right, right.
So
Yes,
it
of
is
course,
more important.
of course. Now, doctor, I think all of us know that being a doctor uh, is a very hectic job. So, is there something that you look forward to in terms of getting your mind away from work and something like a stress buster? Is there something that you look forward to in your day-to-day work
Yes, of
life?
course, everybody wants to give some time to another activities so that he can some bit uh, refreshed from daily boring routines. It's
Yeah.
coming on OPD, seeing patients, same complications, dealing them, and going back to home late when you are not able to meet your children. Also, they used to you just saw them in early morning when you. Drop them to bus stop. That is the only time we got. So,
Yeah.
so I used to do like gym, like swimming
Right.
regularly. But right now, my hospital is actually is
Mhm.
coming. So
Yeah.
this
No,
time I do not able to make much time to even do this half an hour activities also. But
right.
definitely in the near future, I will
Right.
start this routine activities which we were doing earlier.
Right.
So that is
Right.
the main thing. If you go for 30 to 40-minute exercise for yourself,
Right.
that is the best therapy or best
Absolutely.
support to you are giving to your own body. That is very important. Even the
Absolutely.
patient is, if any healthy person or any person diseased, they
Right.
have to make a routine like this.
Absolutely. Yes. Fully agree. And uh, among in your social this thing, like, is there any festival that is the most important for you during the year in your community, your family?
Yeah, we people are full of first festivals: Holi, Diwali, Dasara, Chhat, everything. Um, and Actually, I am from Bihar, so Chhat Puja is very auspicious and very much of importance for us. We used to go our home, we connect with our um colleagues or there is uncles and all. So that is very important. But same, if when you are getting busy, sometimes we won't be able to make time to
Right. Right.
visit the place. That is the
Yes.
irony.
Right. Very true. Very true. Do you get a chance? I'm sure now things are a little different with your new hospital and so on, but let's say a year back or so, did you get a chance to travel at all with your family once in a way, just to take a holiday or something like that? Did you get a chance to do that?
Yes, yes, of course. We wish to plan like at least 2 to 3 vacations in a year.
Nice.
Sometimes it happens, sometimes it doesn't happen.
Yes, of course.
That's
Which
the
is your
thing.
which is your recent most favorite destination that you went?
Last was Pahalgam.
Oh my God. This was
Last was Pahalgam, same place, Danu Valley. We
wow.
were there for like 2 hours.
Oh my God.
And when we got there, just when we reached there, the first this one snowfall start there, and we enjoyed so much, and we had so much of videos, so much of photos of there. And in returning, there's so much of snow in the all the way. We stuck there in Pahalgam for 2 days. There was no connectivity, so it
Wow.
was memorable as well as it was like we'll not go to this place because we got stuck. Our flights got cancelled, everything. And when we saw the Pahalgam attack, later on we able to connect because at that place actually there was no such thing um, that happens there. So
When
that
was
was
this, doctor? When did you go?
we went there in 24th, 24th, 25th December
Okay, of last year.
2024. Last year December,
Barely
last
a
week.
few months before the incident.
Ha, yes.
Oh,
At 1st of January, we will be able to return back to Ranchi by roads only.
wow.
It was like 48 hours journey.
Okay, okay. Crazy, crazy. Yeah, yeah. Do you watch movies, doctor, at all?
Yes, I watch movie.
Which time?
Sayana I saw last,
Oh, okay, okay. Nice, nice.
but that too in Netflix when it came
Netflix.
when it comes.
Yeah, yeah. You don't probably get a chance to go to a theater and watch it in a cinema hall or something like that.
Definitely, my family wants to go outside.
Right, right.
Sometimes in the late night, like 10:30 shows, we're
Yeah,
able to
got it.
go.
Got it. Yeah.
Even in one evening, I was in some mall. तो there was a person who told me, अरे सर आपको टाइम मिल जाता है मॉल में आने का तो it looks like मुझे नहीं आना चाहिए.
Yeah, yeah. No, I understand. Now we move to a section, doctor, that we call the rapid fire. So I'll ask you questions quickly, and then you need to answer very quickly in a short answer. So we get started now. Movies or books? What's your favorite pastime?
Movies.
Your all-time favorite movie?
Sole,
Okay. Your favorite actor?
Amitabh Bachchan,
Favorite actress?
uh, Deepika Padukone.
Nice. Mountains or beaches? What would you prefer for a holiday?
Beaches.
Okay. Tea or coffee?
Tea.
And how would you like it?
It's
Black,
also
masala, with
no,
sugar?
simple milk tea.
Milk tea, regular milk tea, Indian tea.
Regular milk tea.
One food that you can eat every single day.
Chicken.
Okay. If your life were a book, what would its title be?
Uh,
Tough one.
Tough one. I'm not able to
No
answer
worries.
this.
No worries.
Actually.
No worries. No worries. That's fine, doctor. Which is your favorite medical specialty apart from nephrology?
General medicine.
Okay. And your least favorite specialty in medicine?
Uh, it has no answer actually. All the subjects are so good. And,
Okay.
yes.
Okay. Awesome. I think you did very well, doctor. Thank you so much. With that, we come to the end of the rapid fire. And with that, we'll also come to the end of this episode of Know Your Doctor. Thank you so much, Dr. Amit Kumar, for taking the time out and talking to us and letting our viewers, your patients, get a sneak peek into your personal journey, your personal life. I'm sure all your patients would, love to know a little bit more about you while they would interact with you in your OPDs and dialysis and so on a much more professional level, on medical level. I think patients love to know a little bit more about their doctors. I think this episode gave them a wonderful opportunity to get to know the real Dr. Amit Kumar. As parting words, doctor, what advice would you like to give dialysis patients watching you on this episode?
For dialysis patient, my advice is so you be like discipline. Discipline is very much of importance. Discipline in the form of your timing of dialysis, discipline in the form of your liquid intake, discipline in the form of your food, and discipline in the form of your medication taking, and also monitoring your blood pressure and sugars. If you discipline all these things regularly, we will be able to do many things apart from dialysis. Otherwise, we'll keep on doing dialysis and keep in correcting all your problems only. If you discipline the things, then you will be able to get chance for you to be earn something. For you can do many things which you don't able to do by clumsing all these dialysis, medication, breathlessness, sugar control, BP control. If you discipline all these things, we could have a better life, I think.
Wonderful. I think I couldn't agree more with you, Dr. Amit Kumar. Thank you so much for those pearls of wisdom for all of us on dialysis. Really appreciate you taking the time out once again, Doctor, for doing this episode. Thank you so much.